I'm going to talk a little bit about rosacea, more in the vascular rosacea area and sensitive skin. So in rosacea, many patients do report sensitivity, which can be linked to microinflammation rather than dryness. And we heard so much about alpha hydroxy acids, but they can be slightly tricky in patients with sensitive skin and or rosacea. So what I would like to talk about now is how can we make hydroxy acids work for sensitive skins? Also, what additional benefits might they have? The new generation of hydroxy acids. And then I will finish with talking about a new anti-redness serum, which works very well for rosacea, vascular rosacea. So when I just mentioned the new generation of hydroxy acids, what I was talking about were the polyhydroxy acids and the bionic acids. And concretely, we've got gluconolactone, lactobionic acid, and maltobionic acid. And generally, if you look at the chemical structure, you will notice that they're slightly bigger than, for example, a lactic acid or a glycolic acid. So that means that they will penetrate slower. They still have a very, very good penetration ability because compared to, say, peptides or other ingredients we use, they're still tiny and they will definitely get in, but slightly slower pace than the smaller hydroxy acids. And that's one of the key points why they are not irritating. And when we hear hydroxy acids, the first thing everybody thinks about is exfoliation and epidermal turnover acceleration. But they can do so much more, especially the new generation of polyhydroxy acids. So for example, they have got anti-aging effects. So not only the increased cell turnover, and with that an improvement of pigmentation and skin clarity, but they also actually can induce collagens and other matrix components, and they inhibit metallomatrix proteinases, which are the enzymes that cut down collagen, for example. They also have antioxidant and anti-glycation effects, and I'll come back to that a little later because that's a very exciting new evidence that we have. And then, surprisingly, they actually improve the skin barrier function and decrease the water loss through the epidermis. I'll show you that as well. They are compatible with sensitive skin, so there is usually no stinging or burning like you can have with glycolic acids. And as we said just before, they're great to combine either with prescription topicals or even with aesthetic procedures, non-surgical procedures. So a really good kind of staple ingredient that most of my patients are on actually. So what does that mean for the patient? So we optimize the keratinization process and stimulate epidermal cell renewal, which means essentially that the stratum corneum will become more flexible and more smooth on the surface. So patients feel that as an improvement of hydration and a greater pliability and elasticity of the skin. But we also have not only the epidermal effects, but we also have dermal effects. So we know that they stimulate collagen matrix proteins and inhibit breakdown of those. And lastly, they do protect from environmental damage because they have antioxidant and metal chelating properties. I'll explain a little bit about that in a minute. So that means that not only do we improve the skin now, but we also prevent or at least lower the degree of environmental damage caused by pro-oxidative environmental influences such as UV light, near-infrared A radiation, pollution is a really big one that we've underestimated up to now. So you've got the current benefits and you've got the advantage going forward for the patient. If we look specifically at those three polylactic acids again, you can see that all three of them do increase the exfoliation and turnover, and with that we are shedding off existing pigment quicker, so the skin clarity will improve. They all also have plumping and firming effects, so this is more the dermal side of things. And you can see here that gluconolactone was shown in a study that I'll show you in a minute to improve the procollagen 1 synthesis. And lactobionic acid and maltobionic acid were shown to increase other matrix components such as hyaluronic acids or the glycosaminoglycans. And this is the collagen study I just mentioned. So this is our vehicle control, and this was tested in aged human fibroblasts on an in vitro experiment. And what you saw were that the gluconolactone in comparison to the vehicle significantly increased procollagen 1, which is a precursor for our most important collagen in the skin, collagen 1. So what you see on this slide is these polyhydroxy acids do all have the advantage of trapping oxidation-promoting metals, which is really important actually, and also not very much talked about, but this is a huge advantage of these polyhydroxy acids. They also inhibit lipid pair oxidation, all three of them. So that means in particular protection of our cell membranes. They inhibit enzymes that degrade our elastin and collagen. Gluconolactone does, in those studies, we've shown that for both. And for the bionic acids, it was the MMP inhibition that was shown in these studies. And they've got anti-glycation effects and barrier improvement effects. This is the humectant study, which is interesting. So you see here the lactobionic acid, and this one here is gluconolactone, and then you've got here the smaller molecule of glycolic acid. And you can see that especially lactobionic acid is actually binding water extremely well, and that's one of the effects why our water evaporation is reduced with those polyhydroxy acids. This was a study on gluconolactone and measuring transepidermal water loss, published in the British Journal of Dermatology. And what they did in the study was for 4 weeks, the patient's skin was pre-treated with a PHA formulation twice per day. This was a gluconolactone, 8% morning and evening. Then a barrier challenge test was done with an irritating substance called SLS. So it's like a soapy substance in a way. It's really irritant. That was left on for 6 hours. The patch was then removed, and they measured the transepidermal water loss. So the higher the transepidermal water loss, the worse the barrier function of the skin. And you can see here, as expected, if you put neat SLS on the skin, you will have an impairment of the barrier function. So you see that transepidermal water loss is shooting up for most of these, but the gluconolactone nearly completely prevented that increase of transepidermal water loss. Better than glycolic acid as well. Another study published in 2004 in the Journal of Dermatologic Surgery, and this was a study where the researchers looked at solar elastosis. You know, with UV exposure, you get an increased formation of low-quality elastin in the dermis, which is called solar elastosis, and it's mainly happens because of free radical damage in the dermis. So with this study, they could show that gluconolactone greatly reduces the elastosis happening in the dermis. So it has epidermal and dermal effects. These photoprotective effects were mediated via antioxidant effects and were in fact comparable to really well-known antioxidants such as vitamin E and vitamin C. So we never would have thought of hydroxy acids as potent antioxidants, wouldn't we? But the new generation does actually have those great benefits comparable to our classic antioxidants. Now I'm coming to glycation. So glycation happens by a non-enzymatic process between a sugar, such as glucose, But even fruit sugar does that, even more actually. Fructose does it even more than glucose. And these intermediate products, or Amadori products, go then via a series of oxidative steps into permanent cross-linking collagen and other proteins. The first step happens within hours. So you've got the generation of Amadori products that really happens within hours. And then in the next weeks to months, you have the formation of these permanent advanced glycation end products, or AGEs. What happens when you have an increased amount of cross-linked collagen and other elastin, any other protein in the dermis, is that the dermis and the skin in general becomes less flexible, less elastic, so you've got more wrinkling. And also it causes a very characteristic sallow appearance, like a kind of yellowish hue in a way. And as I mentioned before, this is permanent. So for that particular molecule, you can't undo it. Once it's linked forever. What gluconolactone was shown to be able to do is to prevent that glycation. And this is a dose-dependent inhibitory effect. And it was similar in magnitude to a positive control that we use to prevent glycation called aminoguanidine. So you can see that here. This is a positive control, and this is an 0.5% gluconolactone, and a really great reduction of glycation. And we know, of course, these days that glycation is one of the major mechanisms of skin aging, for example. So it's not only the oxidative stress, but glycation is very, very important too. And the other two, bionic acid versus maltobionic acid and lactobionic acid, had a very similar glycation inhibiting effect. So all three of the PHAs that we discussed all prevent glycation or lower the degree of glycation. And with that, you will have less yellowish, sallow appearance of the skin. This was measured in another study, clinical study. And what you see is that there is an up to more than a third reduction of that not very attractive sallowness of the skin. So we know that with age we get more protein glycation. That's even more the case if somebody's having a very high glycemic index with a lot of sugar, but even fructose, sadly, or processed starches, which are a long string of sugar molecules. As soon as you eat them, they're cut down into simple sugars, and all of those will increase our glycation. So it's great that we have topical non-prescription agents now that can help to reduce those permanent crosslinks and the associated clinical effects. So to finish off, I just want to introduce you to an anti-redness formulation, a novel product that contains different multifunctional ingredients, polyhydroxy acids plus others as well. This was a study done on this product in women with sensitive skin. Sensitive skin is reported, self-reported, by over 50% of women on average. So it's a very, very common problem. Whether all of these self-reported cases really have sensitive skin or not is another question, but certainly the patient demand is there for products for sensitive skin. 12-week study this was, and you see here that even after 2 hours, which is the second column, the redness was already reduced and the red blotchiness of the skin as well, even more so after 2 weeks. Of course, we have cumulative effects. And then if you look at the next study, which actually took that to a 12-week study, where also, again, similar parameters were measured. I'll show you the results in just a moment, just on the ingredient side of things. So this was a mix of a 6% polyhydroxy acid blend to strengthen the dermis and also the epidermal barrier function, plus additional ingredients, anti-inflammatory peptides, algae polysaccharides, and Canadian willow herb. So they are all designed to dampen down your neurosensitivity and the hyperreaction to products applied on the skin. Lastly, bisaprolol and white tea extract also present, all in one product. So there's a twice daily application of this serum plus a complete regime built around that with an SPF, with a cleanser, etc. The tolerability of this new serum in the study was excellent. In fact, there was an improvement of dryness and itchiness in those sensitive skins. Just go back, actually, just one thing I want to mention here. So there was only one adverse effect in 44 women, which was a mild outbreak of papules. So when I talk about rosacea and this redness product here, I'm talking mainly about vascular rosacea. Anybody with inflammatory lesions such as papules and pustules should be on prescription medication, topicals in most cases. That's just, I don't think we should soldier through inflammatory acne without prescription medication. However, these skincare products like the anti-redness serum really help to increase the tolerability of our prescription creams, and with that the adherence again. So here you can see the results. So we've got an improvement of up to 40% of redness and brightness of the skin. This is after 12 weeks. So again, you can see a cumulative effect over time. But not only that, not only the redness did improve, but as a nice side effect, we also had an improvement of skin aging parameters. So you can see here, of course, that starts generally later because collagen production does need some time. So we've got an improvement of crow's feet, lines and wrinkles, texture, smoothness, and pigmentation as well. So it actually is great for women who have, or men, both of these concerns. So sensitive skin, redness of the skin, and also starting signs of skin aging. And for that group, it's quite difficult sometimes to find products because a lot of the over-the-counter skincare products for sensitive skin are very, very thick and occlusive because the cosmetic scientists have more the atopic eczema type of sensitive skin in their mind when they formulate this. But if then somebody goes into a shop and sees this balm-like substance and it says, good for sensitive skin, you will then, of course, potentially cause a flare-up of inflammatory rosacea with papules and pustules. This serum, however, is a very light formulation, base formulation, so it wouldn't, in most patients, have any negative impact on inflammatory rosacea. And you can see here, again, this was a self-assessment that actually were quite aligned with the objective assessments in this study. So an increase of effect over time, the face looks less red. So patients noticed that as well as the expert graders and the imaging. These are some images from that imaging. You can see at baseline vascular rosacea, 2 weeks slightly better, week 6, week 12. So this, if you compare the baseline to week 12, is a very, very significant clinical improvement. Has it completely disappeared? No, of course not. I don't know, and I can't imagine any over-the-counter product to completely get rid of facial redness. We've got a prescription item called Mirvaso, but over-the-counter, I don't think, and that's just, of course, working temporarily for about 8 hours. But this is a product that greatly reduces the redness. If you want to do more than that, then we are really looking at a light-based treatment such as laser or IPL. Close-up of a patient, and again you can see during the 12-week duration of the study, the redness has improved very significantly. And another patient, I think you can really appreciate that. These pictures, by the way, are photographs taken under cross-polarized light. So they make pigmentation more obvious so that we can actually measure objectively with these machines how much improvement of the redness has been achieved. So in conclusion, there was a significant reduction of redness and temporary flushing as well with this calming anti-redness serum. And as a nice side effect, we actually have anti-aging effects as well. So that's great for kind of women in their 30s, 40s onwards. And that's, of course, when a lot of those women do develop rosacea and have that concern. And also, although the regime did contain hydroxy acids, it was extremely well tolerated without any stinging or burning. And that's because this actually contains the next generation of hydroxy acids, which are the polyhydroxy acids, much better tolerated even for sensitive skin.